Welcome to the Complete Streets at SCDOT and Achievable Win concurrent session. I'm Ned Barrett, Trail Coordinator at Partners for Active Living in Spartanburg. Now in our 16th year, Partners for Active Living advances active living, promotes healthy eating, and fosters health equity. We work in schools to help them develop sound, healthy policies and programs. We spearhead the Spartanburg Food Coalition to support healthy eating, working with emergency food providers and others to increase access to fresh produce. We work with the city and county of Spartanburg to develop trails and parks, providing safe places for people to be active, connecting neighborhoods, schools, community institutions, and commercial areas into a cohesive and comfortable trail network. The concept of complete streets has been useful to us in promoting safe streets for all, and the development of sound policy initiatives to enforce them will go a long way to helping South Carolinians be more active, healthier, and safer. In this session, you will learn how the South Carolina Livable Communities Alliance successfully advocated for a statewide complete streets policy to the South Carolina Department of Transportation. You will also learn the value of grassroots and coalition advocacy in achieving policy wins, data and equity in achieving policy wins, and state policy in coordinating with local policies. Today's speaker is Amy Eli Johnson with the Palmetto Cycling Coalition and the South Carolina Livable Communities Alliance. I hope you enjoy learning more about the importance of complete streets policy and how the new state policy will affect your community.
Amy Johnson Ely, what's up? How are you?
Hi, good. It's good to see you, Phil. I'm so happy to, what a great intro. And I'm just excited to talk about this.
Yeah, no, and I'm just going to introduce myself to everybody out there. Hey, y'all, my name is Phil Ford. I use he and him pronouns, and I'm the policy and advocacy consultant for Eat Smart Move More South Carolina. And I'm super stoked to have my good friend and my happy hour friend, Amy Johnson Ely, here to have this conversation about a huge win that has been a long time coming that I'm really pumped for you all to hear about. But Amy, let's get started. You know, a lot of people call us very passionate about the work that we do. So I want to learn a little and let others know. Give us an intro to you, why you do what you do, because it's really truly a calling, because you're just so passionate, so knowledgeable, so committed. So tell me a little bit about yourself. Tell the folks listening a little bit about yourself.
Sure. So I live in Columbia. I've been working for PCC for about 9 years, almost 9 years so far. And I have always been a bit athletic and rode a bike from a young age, but I also had a lot of interest in politics. And public space. My mother worked really hard to get sidewalks out on a main road out just outside of our neighborhood, and rode the city bus to school for a little bit when I was going to a magnet school that was super far away, and just really had a lot of. I really didn't understand how much passion I had for transportation until later on. Everything just kind of came together. So. I did a lot of volunteer work too. That's actually where I started, at the local level in Georgia, in Athens, Georgia. So, you know, don't ever underestimate the passion that comes into volunteer work. You never know where it's going to go. So as far as growing coalitions, you know, I've always had, this has been a great learning experience, but it also gave me an opportunity to really express I just really loved working with other volunteers and trying to grow this coalition.
No, that's great. And I do have some questions about the coalition that you built a little later on. So I would love to model what you've done myself. But you mentioned Palmetto Cycling Coalition, and that's the organization that you're the executive director of. But you also have the South Carolina Livable Communities Alliance, of which Eat Smart Move More is a member of. Can you talk a little bit about each organization separately and how they've worked together?
That is a great question. I should have addressed that first. So Palmetto Cycling Coalition has been around for over 25 years actually, and it started as an aggregate, and it still is in a lot of regards, an aggregate of bike clubs across the state. So these are bike enthusiasts And there was a sense that the state owns most of the roads, and that there needed to be a statewide coalition to do something and to educate people how to ride confidently and therefore more safely. And so we have evolved to really have a pretty good understanding of how the DOT works and how our state DOT works. And because of that, and the fact that a few years after I started the job, we incorporated walking into the mission, which is a central mission, walking and biking safety, but there are other goals outside of that: health, livable communities, and economics and sustainability. And so when we saw the need for the Complete Streets policy change, it wasn't too much of a stretch to really try to grow that and make sure that the message on that was livable communities, because that's something that people can rally around. And it is about bikes, but it's also about a much larger thing. And you can't get anything done often if you're just talking about one thing. And so we decided to broaden it, mainly because DOT is a monster, of a beast of a policy target. And we knew that we would have to be bigger than the PCC. So the South Carolina Livable Communities Alliance is kind of a brand, but it's also really, it's to nail home that it's not just about bikes and that this is an inclusive movement, but certainly it was driven by the PCC and the Palmetto Cycling Coalition. And we got a great grant also that really enabled us to focus on it. So we needed that.
Yeah, no, the work that the Alliance has done has just been phenomenal. And when you say DOT is kind of a beast of a department, there are so many aspects, so many ways to impact change. Which way do you go? But with that being said, you mentioned safety and other economic aspects, sustainability, health. So why exactly did y'all form? What was the exact problem that you wanted to address with these two organizations, and with this massive campaign that you have successfully run?
Thank you for that. So let's see. So the problems. So I got to South Carolina from Athens, Georgia, in 2012, and there was a group formed called the Communities for Cycling group. The director before me, Rachel Bronson, created this really as a response to cities saying, hey, we want to do this, but how is it happening in another city? Or, how are they getting it done? And why are they able to do something innovative and by making the streets safer? This is all engineering, right? And how come we can't do that? And what can we learn from them? Are they working with DOT better? And so this evolved, and I kept listening to these conversations, and I started to remember the common challenges that people were having with DOT. And so there's many ways to get these to make the streets safer at a local level. But in our state, we have a unique problem where our DOT owns about 70% or so of all the lane miles. That is far greater than most other cities. So where it has been considered and actually dealt with in many other cities at the local level, that is still very relevant, because you can't do this planning really unless you think about the local fabric. But to solve that challenge, we had to go to DOT to solve it, because Charleston couldn't get, at the time, that has changed now, they couldn't get basic. They would go to DOT and they would say, we've got X number of people dying here, and which is your baseline of a need, right? And we want to save X number of people's lives, and this is what federal highways says can fix that, and they were getting the no answer on things like that. So what we did is we first went to DOT and we said, look, here's the data. And I'm going to be honest that at the time they knew bit of that data, but they didn't understand that over the last 10 years, it was going up like this.
Right. And I want, if you don't mind, elaborate a little bit more, because, and I may be off on the statistics just a little bit, but we were 4th in pedestrian safety deaths in the entire country. And at this point, I guess 2 or 3 years ago, the United States Department of Transportation, or the Federal Highway Administration, was threatening to cut off our funding to the state if we did not address the number of deaths. Is that? Because that's what you're trying to do here. You're trying to fix the problem with DOT.
Let me think if I can explain that a little bit. So I think, so the laws, so it's not quite that bad, but what it is that right now the law, I believe, is such that if you're a certain number of injuries and fatalities contributing to the total, this state, that the federal government has the authority to influence your funding down the road. It's not exactly an immediate response, but there is, but that is a bit in the law. So essentially, though, they were getting away with it. The laws are going to strengthen soon. The regional planning bodies across the whole state, the councils of government, and the urban metropolitan planning organizations, they were supposed to be developing these bike ped plans, but they were getting away with a page within a larger 300-page planning document, the long range transportation plans, and that's all they had to do. And there is a requirement from the feds that happened, but nobody's coming back. There's not a consequence for not doing it. And so what we tried to really drive home to DOT is that, look, and we got the data. It turns out, I mean, this, all you got to do is ask. So, Department of Public Safety is the warehouse for all this data. There's tons of data out there, and local planners use this data all the time as a metric for looking at where they need to improve safety features. And so we crunched the numbers. As part of this grant, we paid to have all these data verified and really fine-tuned. And we were able to go to DOT with something very compelling, which is that 95% of your fatalities for people biking and walking are on state-owned roads. And the local roads, they do still own a certain number, but they certainly they didn't carry the responsibility. So we shifted the weight of responsibility, because DOT kept deflecting it, because I'll be honest, that they were actually honestly believe that it wasn't their responsibility, because it is considered a local thing. Biking and walking is inherently a slower mobility mode. And so you don't think in terms of big state highways, but it certainly needed a state systemic fix.
Yeah, no. And that really, we'll get into what the policy actually does, but I want the folks watching us right now to really understand from beginning to end how you kind of worked this through. Yesterday, Tremise and I had a networking session about intersectionality and bringing different voices to the table, and it's hard work. And there are so many personalities at the table, but the way that you were able to bring in racial equity and civil rights groups, disability organizations, transportation experts, public health groups, you name it, planners that all have this expertise that, some folks think that they know better, and, bringing all of these folks together isn't easy work. But I'd love for you to share how you built this robust coalition and how you made it work, how you managed the folks to bring in those, to make this change a reality.
I will fully admit that this would have been possibly insurmountably difficult if we hadn't gotten funding, because it took years. Now, some of that, maybe some of that was a learning experience. And also we had a challenge where we originally were targeting a decision to occur at the SCDOT commission. So there's the commission, there's the legislature, and then there's the agency. So the legislature and the agency and the SCDOT commission is a 9-member body that supposedly passes policies. And then what happened is then we got like a legislative bill that was actually really good. So so that was a challenge, but it took us about 4 years at best. It may have taken us 2, but we needed that. And so what we did in that time, navigating through these other opportunities where there was a legislative bill that came out of Charleston, we were kind of bouncing around a little bit, but I feel like what we did is we continually sent different groups to tell their story to different decision makers and also to the media. So the media does 2 things. It can target, what happened is stories would come out and the DOT commission chair at the time would be embarrassed, or the Secretary of Transportation would be embarrassed. And instead, it is a bit of a calling out thing, but then you would come back and try to call them in and have a conversation. And there were some opportunities where we could have really elevated the drama within the media, and I believe that we tried within social media and also within news stories that usually were a response to a death, and there were 200 a year typically, so there's a lot of opportunities. Anyway, what we never really we tried to never turn it personal.
There's always that fine line, right?
It's a fine line.
There's a fine line of do we want to solve the problem, or do we want to perpetuate right?
Yes. And so I always say that advocates are in the professional advocates and especially volunteer advocates too. We're in the business of managing frustrations, people's frustrations. And so being able to kind of squeeze that down the middle and walk that fine line is the way to do it, because we've got to both address these frustrations directly, but then never let it turn personal. And so we had groups, for instance, all right. So what we did is we with regards to planners, we took input from the planners to actually help write the policy. So I drafted it based on national best practice. So this is just one group, and they got input. So then they had a vested interest, and so they helped to amend the draft policy, and the whole thing changed, eventually down the line. But I continually tried to incorporate people. So the planners were able to continuously give us feedback. And then if we got pushback from DOT on something, they were able to help us understand whether that was still a priority or to back up with it. Equity groups. There was a DOT commission commissioner at large who's directly appointed by the governor, JT McLaughlin, who is the CEO of the Columbia Urban League. And I had started a conversation with him maybe about 5 years ago, before this even started, because I was this is before he became a commissioner. The fact that he became a commissioner was total luck. But what we did is we immediately continued to have conversations with him. He became a champion of this. It's very rare to find a decision maker that's going to really push really hard on something. And so that he wasn't willing to push super hard, but he was invaluable the entire time. And his input on the equity conversation was really important. We also spoke to urban leagues in Charleston and Greenville and got their input. They signed this policy letter of support. There was National Action Network testified at the state legislature. Low Country Alliance for Model Communities looked at our draft and reviewed that as well. Disability groups, we had them. We had Able South Carolina participate in a multimodal advisory committee meeting, which Phil with Eat Smart Move More also attended. And was all of these are not easy meetings, but they can get a little bit tense, but they are still extremely valuable because the information that is shared doesn't go away. And that was important. Corinne, I hired Corinne to do the grassroots engagement, and the best thing that I could have done is hire Corinne with her specific skills that she had with regard. She was fearless on the telephone and through email and social media. And we eventually got 25 mayors to sign that policy letter of support.
Yeah, well, that actually goes into my next question about the grassroots work that y'all have. I mean, it's phenomenal, the work that you and Corinne were able to accomplish, and with the mayors, like you mentioned, local organizations, like you mentioned just before. They really did some major work. Talk to me a little bit more about the grassroots side of this, and how it was really from that end that you brought all of those folks up to the DOT commission to testify. Mm-hmm. I testified and invited them to come to Orangeburg to walk along the road, and even invited them for a little bit of barbecue, which they got a chuckle out of. But mm-hmm. That's such a huge part that I feel like a lot of folks miss, is the grassroots, and y'all just did an amazing job with that.
So we testified at the state legislature in 2019 when the bill came out of Charleston. We shifted from DOT commission to the state legislature. We didn't know for sure if this was going to move through the legislature, because we've got other. The legislature is not an easy place to push a transportation bill, and so because it's hard to communicate exactly what we're doing. And the other thing is that DOT knows how to write a policy, right? They do. And we felt that there was enough leadership there that things could work. So we testified many times to the DOT commission, and also many times to the state legislature, because there were these two opportunities to really make change. And so because we had to have the conversation politically, but also on a technical level. Because if we just moved through the legislature, we never would have been able to really fine tune what we wanted on the technical level. So at the legislature, we had South Carolina chapter of the American Planning Association, which was key because there's not a local planner around the state that doesn't want to accommodate people biking and walking for economic development, for just meeting the needs of the people that live in the area to get around, to get on a bus stop safely, right? And not have to walk on a dirt path constantly, and to create some dignity for all of these small, medium, and large towns and cities. And so that they testified at both the DOT commission and the state legislature. We also had AARP testified at both. Cherie Muse was fantastic. Cherie Muse also, she's with AARP. DOT took her very seriously, walked her out after the commission meeting, face-to-face conversation. That's a big voting demographic, and they also have power in the state legislature, so they were taken very seriously. So all of these pieces kind of serve the functions to work it politically, but also to try to get a good technical sound document. And so who else? Coastal Conservation League. These were folks that testified at both of these arenas. Who else were we missing? Oh, Women's Rights and Empowerment Network testified at both. And then, gosh, who am I missing? That was a big one. Community Development Corporation also, which is the economic angle. So it was health, equity, economic development, sustainability, and safety was the sort of central thing.
Yeah, I'm going to go ahead and ask folks to go ahead and put your questions in the chat so we can get those over to Amy. But I'll ask you, I've got a couple more questions here, and one that has come through. This policy, explain to folks what exactly it will do, because we've talked about it. We know that this policy could be a model for other places around the country. But tell us exactly what this win does.
Sure. So what it does is it establishes that this is the new standard for DOT. It puts that front and center. They revise their design guidelines as well. So it is an overarching policy. It's a departmental directive. It is not exactly a public policy, but it is internal agency policy, and that still has a lot of weight. So what it does is it requires that the regional planning bodies that are inclusive of all the rural areas and the small towns, and the metropolitan planning organizations, which are the urban areas, which have at least 50,000 people in each of these centers, that both of those planning bodies throughout the entire state, it doesn't leave an inch uncovered, that they develop a bicycle and pedestrian master plan that has planning guidelines, which are incorporating the safety statistics that DOT gives everybody. First of all of these, so it establishes guidelines for criteria, and then it requires that all of these plans be prioritized so that the areas of greatest need have to be accommodated first. So transportation equity is one of those guidelines that is yet to be defined, but we believe that it is essentially looking at demographics, and that there needs to be a recognition that certain variables that correspond with injuries and fatalities, and we think poverty and lack of vehicle ownership are two ones that stand out for our state, that those cannot be ignored, that if these are not being equitably applied, if they're only going to rich areas, that it's problematic. So that's our definition of transportation equity, and that is in there. What else? That corridors have a certain level of service to provide mobility for people biking and walking or accessing a bus stop between origins and destinations. And so it requires certain guidelines, planning guidelines. It's not a standard. We wanted a standard, but we got a guideline, but that's better than not. And it requires that the whole state, all of these planning bodies create that. Then the best thing about this policy is that it creates funding. It explicitly explains how every funding pot that contains state and local money, but basically every funding pot that is used on a state-owned and managed road, which is most of the roads, sometimes neighborhood roads, that they kick in if these bike and pedestrian master plans are adopted at the MPO, Metropolitan Planning Organization, or the council of government level. So that's what's key, is to get these plans adopted at that level into transportation improvement program, into the long range transportation system.
So there's a question that just came in the chat. When do you think the local communities will see change happen from the passage of this internal policy? I know that we'll have to go through the local planning and council of governments to make sure that they adopt plans too. Mm-hmm. But by DOT doing this, I think it kind of puts pressure on everybody else, right?
It does, because what DOT is doing is they are, they have an engineers conference every year, and they have a planning conference every year that they host. And so this is going to be a major topic for sure of both of these conferences, because they are going to have to train not just the DOT folks, but the local folks that get invited. So your city planning and engineering staff, your county planning and engineering staff, your regional planning body, either the metropolitan, urban, or the rural, the council of government, those engineers and planners that work really at those three jurisdictions, from the local all the way to the regional, they will be trained through these conferences, and this will become something that will become understood. So there are some technical challenges though, because for instance, City of Columbia has a bicycle and pedestrian master plan from 2015, but they have struggled to get it incorporated into that at that regional level. And we expressed all of those concerns from the planners on these advisory committees that we had, and that will be something that we'll continue to advocate. Basically there has to be one place for the information. So that's what DOT stressed.
So if you had to put it in years or months, do you see it happening or starting to be implemented locally within 1 to 2 years?
So it should take a while. Now, we aren't going to see infrastructure on the ground immediately, because what we should see is that if local communities and cities and counties and regional planning bodies, if they want to see an innovative design, if DOT kept saying no, they're going to immediately start to change that tune. That has changed already. I've already seen that, this past February, this year, and I've already seen the yes start to occur. As far as funding and your data getting kind of in the right place from these master plans, that's going to take many more years.
Right. Okay. Well, we have, I guess, about 3 minutes left in the session. Is there anything else that you would like to share with folks about either how to get in touch with you to do that local work, or, something that I didn't ask you? Like, I'm not a Katie Couric or a Mike Strahan. Don't have those interview skills. But what else do you want to share with folks?
We intentionally made this a broad movement because one shocking piece of data the reason why equity was truly front and center was just because it's, you kind of see that there's data out there that supports it. I'm privy to, that's how I speak sometimes is with this data, because I have a geography background. But just to put it in perspective, you bike into, drive through rich neighborhoods, you see infrastructure. You do the same in neighborhoods where the income of these families is lower, and you often see a lack of infrastructure. I was recently in Charleston, going through a traditional neighborhood that had been there the whole time. And there's a sign on there, and there's loads of people that live there. There's a sign on the road that says, walk towards traffic on the white line. There's a sign that says that. You go a little bit further, there's a brand new development with $500,000 homes, and there's sidewalks everywhere. So, excuse me, that combined with the fact that we know specifically the data that while our state 28% is African American, 45% of our bike and pedestrian injuries and fatalities are on our African American population. And so that's a huge disparity, and that's what this policy tried to address. Unfortunately, there's things that happen where so Farrow Road was a bit of a disaster. Not enough time went into engagement and outreach with these communities. And so what we tried to do is to widen the amount of time that engagement would occur instead of just throwing pavement down. So that's one thing that I really want to stress, is that this equity, health equity, transportation equity, that's why we considered that a huge win, because we know that rich neighborhoods typically have no injuries and fatalities. In fact, the data supports it across the whole country. Yeah. Every U.S. congressional district. So, Phil, thank you. And Eat Smart, Move More, thank you so much for your enthusiasm, especially with this campaign the last few years and the time that you put into it. We just really appreciate it.
No, well, thank you for sharing.
And my email is amy@pccsc.net.
Say that one more time for everybody.
Or amy@palmettocycling.org if you want to get in touch with me. I'll take anybody's request for help.